Hello, welcome to Dental Notes and Mnemonics. Today we are going to discuss about the different types of the nerves, their characteristics and their essential functions in the human body. Nerve fibers are like tiny wires that carry the messages between the brain, spinal cord and the rest of the body. They help in different parts of the body to communicate with each other, and this allows us to feel things, move and control things like our heart beating or not beating without even thinking about it. Nerve fibers can be divided into different types based on how fast they send the messages, whether they are covered with a protective coating or what they do inside the body. On the basis of their speed and their size, they may be categorized into A fibers, B fibers, and C fibers. The detail about these fibers we'll be discussing in the coming slides. On the basis of protective coating called as myelin on the nerve fibers, they may be classified into myelinated and unmyelinated fibers. Myelin sheet helps the signals to travel faster. So in this case, the myelinated fibers, as they have this protective coating, so they send signals quickly. On the other hand, the unmyelinated fibers don't have this coating, so they work more slowly. On the basis of functions of the nerve, we can group nerve fibers into based on what they do in the body. So there are sensory fibers and motor fibers mainly, and apart from these two, autonomic fibers are also there. Sensory fibers, they send the messages about what we feel like pain or the temperature. Motor fibers carry signals that help you to move your muscles, and autonomic fibers control the organs and the glands, making sure that heart or digestion works properly. All fast between creeping low. This mnemonic will help you to recall the relative speeds of different types of nerve fibers. All stands for A fiber, which is the fastest nerve fibers in our body. They send signal really very quickly, between 70 to 120 meters per second, and deal with quick responses like sharp pain and motor control. Fast reminds us of A alpha fibers, which is the fastest among A fibers, sending messages even faster between 80 to 120 meters per second, and they help us in our muscle move. Between refers to B fibers, between to indicate that they are in the middle of in terms of speed and functions related to autonomic nervous systems. These fibers are medium speed, sending signals at the rate of 3 to 15 meters per second. They control things we don't think about, like our organ systems or autonomic nervous system. Creeping stands for C fiber, which is the slowest. Low representing C fiber are the slowest. They send signals very slowly at the rate of 0.5 to 2 meter per second. These fibers are important for sensing dull, pain and temperature. And low reminds us the C fiber at the bottom of the speed list, highlighting their slower conduction speed. Let's explain the function of all the nerve fibers using mnemonic. Alpha bears go dancing by campfires, and relate each part with the respective fiber types. Alpha bears are A alpha fibers. These carry the motor signals to the muscle, and thus they have the motor control, and they also have a function in proprioception by sensing the body position. A beta fibers, in this case we can add beta to fit the mnemonic. They transmit the sensory information like touch, pressure and vibration. A gamma fibers represented by go dancing, and these fibers control muscle spindles which regulate muscle tone and sensitivity. And A delta fibers can be represented by dancing, and it can be linked to delta fibers, and the function of the delta fibers is to carry sharp acute pain and temperature signals. Bi denotes B fibers in the mnemonic, and the main function of B fibers is to have the autonomic functions like transmitting signals to the smooth muscles, heart, glands for involuntary action. And campfires stands for the C fibers, which carry the slow pain, which is dull or aching, and temperature sensations as well. Now we'll discuss about the clinical relevance or diseases which is associated with these fibers. Alpha fibers is associated with the amyotrophic lateral sclerosis, which causes muscle weakness and paralysis due to motor neuron degeneration. It also causes the peripheral neuropathy, which damages the alpha fibers and leading to muscle weakness and loss of proprioception. Beta fibers are affected in autonomic neuropathy, where they affect the involuntary functions like heart rate and digestion. C fibers are involved in the chronic pain syndrome, which damages the C fiber and lead to persistent dull pain. And small fiber neuropathy also affects the slow pain and temperature sensation, causing burning pain and the temperature dysregulation. This table summarizes the all the things which we have discussed till now. You may note it down. And thanks for watching. And if you found this video helpful, please give it a thumbs up and don't forget to subscribe to the channel for more informative content. And hit the notification bell so you're always updated with the latest videos. Thank you. Thanks again. And I look forward to seeing you in the next video. Thank you.